Okay, good evening, colleagues, and thank you for joining the Champions webinar this evening with Dr. Mudupe Omanuju, Consultant Public Health, Birmingham. Our usual Zoom etiquette, please, if you could ask colleagues to keep the mics on mute unless obviously you're speaking. You can use the chat function for questions and comments or to indicate you'd like to voice a question. You could also raise your virtual hand, the hand icon, if you want to voice a question or to indicate that you'd like to ask a question. The call is being recorded for minutes purposes and it's not for the public domain. And I'll post the agenda on the group chat. And also apologies if you never received a text message reminder of the meeting today. We had a few technical issues with the BCC website and also the platform that we use to send out texts. Hopefully it'll be resolved, and the next meeting onwards, moving forward, will ensure that a text reminder is sent out to yourselves as well. The agenda, a COVID update from Dr. Manuju, vaccine survey, current issues. We'd like some feedback from yourselves about whatever the current issues are pertaining to COVID in the communities or the people that you work with, any of the business, and the date of next meeting, which is Wednesday, the 1st of September at 6 p.m. Okay, I'll hand you over straight to Dr. Manuju for the COVID update. And whilst I do that, I'll also bring the COVID information up on screen for you, Doctor. Over to you, Madupe.
Thank you very much, Habib. I hope you can hear me.
Yeah, we can hear you.
Brilliant. Thank you. And thank you to everyone who is here today. Apologies. I'm sitting in my car just waiting to ferry my daughter off for her athletics training this evening. And I didn't want to miss the session. So I've had to sit in the car park whilst I speak to you all. And I hope everyone is keeping well and enjoying the weather and the relaxation of rules that we've had since we moved on to step 4. Our update, which Habib has kindly shared, actually has shown a more promising situation with the COVID response than we had the previous week, where the infection rates actually went up, but now it's gone down. As you can see on the green arrow, it's gone down from the previous week. So up until the 15th of August, rates are falling to about 314.1 per 100,000. We also know that testing has fallen as well to 5,688 tests performed. So PCR and lateral flow LFD tests per 100,000. As always, these figures may not necessarily reflect what's happening across the city because people who test may not necessarily be putting the results on the system. And so this is based on the reported tests that we picked up via the portal, the NHS portals. On the percentage of tests that have been completed, which have come out as being positive, you'll see that on the far right, on the red arrow going up, compared to the previous week, that's gone up. So we have 16% of the testing coming back as positive, and that will be around perhaps around just under 1 in 5, about 1 in 6 tests performed have come back as positive on the PCR, which suggests that there are still people who are experiencing quite a lot of disease from COVID-19. And so we still need to remain cautious. And as we've always said in the newsletters and in our correspondence or emails and information that we've shared with you as champions, it's important to continue to remind everybody that COVID is still very much with us as we enjoy the relaxation of rules and the ability to mix and meet loved ones and our friends. We know that COVID still spreads a lot more when people are in groups indoors where there's poor ventilation and where people are socializing, for those who have to go out to work, those who are going to work. And so it's about continuing to follow the rules around hand-face space. When you can, please wear a face covering if you're in a place where it's crowded. The other thing to bear in mind is the vaccination, which has been shown to be making a difference and helping us to reduce the number of people who are in hospital or who sadly die from COVID-19. And that brings me to the update on the hospital admissions, which we see has remained almost the same, actually, although the slide says it's gone up slightly from 274 to 285. We do feel that those cases, compared to what we've seen before, have not risen as sharply as they could have if we didn't have this vaccine. So that's a credit to the current vaccination program and the effort that you've all made as champions, and everyone who has been championing the vaccination program and encouraging those people who are eligible to go and take the vaccines when they're offered. We know that sadly we had 8 deaths reported as well during that reporting week. And when we look at the wards that have experienced the highest rates of COVID-19, those have included King Standing with 513 cases per 100,000, Shard End with 495 cases per 100,000. And I think the list goes on with the top 10 wards having a range of from as little as 420 cases per 100,000 in Glebe Farm and Tile Cross, all the way to the 513 per 100,000 in King Standing. And that you can see is much more than our citywide rates of 314 per 100,000, which shows that there's still an inequality when it comes to COVID rates and the experiences that people have depending on where they live in the city. And so we are trying to continue to ensure that regardless of where you live, you can still, safely go out, enjoy the relaxation of rules, but more than anything, I think, be assured that your case rates remain as stable as possible by not going out when you've got COVID-19. And therefore, people are expected to still be carrying out their twice weekly lateral flow tests, which are largely now down to personal responsibility. So I've had my test today before I left home to take my daughter for athletics practice. And I think it's just encouraging everybody to keep doing that. Although we know we have COVID fatigue, we have a responsibility to keep each other safe. And for those who have symptoms, please do continue to book your PCR tests via the system online. And if you need any assistance with that, we put a lot of information out about availability of tests in the local areas as well. When we look at the cases across the age groups, we know that across all the age groups, we saw an increase in the cases. And notably, we've seen more cases, I think, increase in cases within the 60 to 79 age group, which is interesting. And I think that again might just be a reflection that there's more testing going on in those age groups. And I think in the younger age groups, the 0 to 19, because our schools and higher education settings are still closed, the universities are all still closed, we perhaps are not getting as much tests reported from the young people. Just looking at the case rates across the ethnic groups, it appears that this has dropped, though, as we mentioned earlier, this is based on tests that have been reported that have come back as positive, not necessarily reflecting what is actually on the ground if we haven't got everybody tested religiously. If we go on to the vaccine slides, please, just to show you what's happening currently. So as we probably have heard, the vaccination for 16 to 17-year-olds has begun. And you can see there already about 10% of that age group have been offered their first vaccine and taken up the offer. I think all of them have been offered, but I think 10% of them have taken up an offer of the first vaccine. And I think just over perhaps 3% or 4% have had their second vaccine. And that could be because those are the ones extremely vulnerable and were offered the vaccines a lot earlier than others. As you go down the graph, you can see on there that we still have quite a few people in the younger age groups between 18 all the way to the age of about 49 who are yet to take their first vaccine, so lower than 70% still in that range who have had their first vaccine. And when you look at second doses, it drops even further. So for 40 to 49, less than 60% have had their second dose. For 30 to 39, only 40% have had their second dose. And then from 18 to 29, it's about half of that, about 25%. We still have about a third or slightly more of our adults over the age of 18 who have not had their COVID vaccine. And when you compare our rates of vaccination for 18 plus for the UK, actually for England, when you compare that to the rates in Birmingham, we still have a difference of about 20% that haven't had their vaccine in the city compared to England. So we have a lot to do to continue to reassure people about these vaccines and to ensure that everybody understands that they are safe, that they can have a conversation with a trusted person if they have any doubts, and to ensure that people who are most at risk and most vulnerable and those who are perhaps more likely to end up in hospital or dying are able to quickly take up this offer. We know that from some of the engagement we've been doing recently, there are those who feel that they're fit and well and are not at risk of serious illness from COVID-19. But I think we've seen a lot of stories and examples from people in ICU who thought they were fit and well and have ended up in hospital with severe illness. So we are encouraging more awareness, particularly with the younger age group. And we've been working with some of our stakeholders, our universities, higher education institutions, our youth champions, to do some awareness around safety and the fact that nobody really should take this virus for granted. And I think the last bit on the slide, the last slide is just showing you the differences across the city by ward when it comes to low vaccine uptake. And as you can see, those wards that are still quite low are the ones that we've been showing on a weekly basis. And we have been doing some targeted engagement work in those wards just to understand the barriers or why people might not want to have the vaccine. I think a lot of what's coming out is that people don't trust the vaccines and want more reassurance and more examples from us about why they are safe and why they need to take them. So I think if I sort of stop there, we can hear from you all and perhaps explore some of what you're picking up on the ground regarding vaccine safety and what we can do. Thank you, Habib.
Thank you, Modupe. Any questions from anybody or any comments regards to Modupe's presentation around infections or vaccines? No, I don't see any hands up or anybody. Okay, that's fine. For the next, that moves me on nicely onto the next actual agenda item, which is a vaccine survey. Hopefully you all would have received a copy of the Champions newsletter, and in there's a link for a short, sharp survey that we're doing just to kind of ascertain what could be some of the reasons why people may not be having the vaccine or taking the vaccine. And the purpose of that is that, we're hoping that the survey results will actually support us with a better campaign. We're hoping to develop a campaign in the next week or two, or next couple of weeks rather. And what we're looking for is for you guys to complete that survey. So if you could complete that survey, it will really help us to drive and shape our campaign around the vaccine uptake. So please look for that in the article. If nobody has received a copy of the newsletter, please email me. You can either email me directly or to the Champions inbox, and I'll be more than happy to forward you the link. Okay, there's a question in the group chat. What's the thoughts, plans about individuals getting a booster jab? Modupe?
So the plan is to start the boosters from the autumn, and the lists, I think, will be based on the top 9 priority groups that the JCVI published before. So those who are over the age of, it started from 70, didn't it? And then it moved on to the clinically extremely vulnerable, the NHS social care staff, who we've talked about before, carers, those who are COVID at risk. And and then the hierarchy will carry on like that. I think the plan is from the government, from the announcement we've had, is to prioritize those who are over the age of 50 for the booster doses. And we've had some comments, I think, from a meeting earlier this week, isn't it, Habib? The faith meeting, where we were asked about the value of giving a booster because people weren't sure. So there's a very helpful link on the British Heart Foundation website. If you remember, Habib, we shared that the other day.
Yeah.
And what we thought we might do actually is pop that as an additional comment on the vaccine toolkit, so that if you need to have conversations with people. Now on the newsletter, we have a section called the Get Talking section. So I think actually thinking about it, Habib, we could have maybe on next week's newsletter on the Get Talking section, a little blog booster vaccines and why they're important. Should we do that?
Yeah,
That can help
we'll do
in terms of the conversations. Yeah. And just going back to the health and social care staff, I don't know if we've said this before, because we have so many engagement meetings. I always forget where we've said what, or we haven't said something. So there is now clarity that from November, and I think it's about the 11th of November, anybody who works in care, in social care, will have to have had their 2 vaccines to be eligible to carry on working there. And that includes volunteers, from what the guidance or the link on the announcement said. So that means that between now and about the middle of September, I think it's about the 16th of September, if I remember the dates, anybody who works in social care should have at least had their first jab or their first dose, so that they're able to have their second dose within 8 weeks, isn't it? Of their first dose. So yeah, so there is a lot as well there in terms of, for those of you who have perhaps who work in social care, or who have people who are in care homes, or who have domiciliary carers coming over, or who work with people who access social care services, or if you volunteer, this is going to have an impact on the workforce and the volunteers. And so we have a responsibility to work with the people in these settings, to really reassure them and to understand what we need to do to avoid us ending up with a skills or staffing shortage in that industry. And Dr. Justin Varney, our DPH, was doing some webinars, actually. I think he did one today at 5 o'clock, didn't he? About with the care staff in one of the sectors, which we'll be sharing out with other people, just to raise awareness in that sector. And if there are any other ideas about how we can access people who work in care beyond going through the employers, which I think we are doing as well, it would really help, because I think there's an urgency there. When you look at the figures we presented earlier, we still have a lot to do to ensure that people in that sector, who work in that sector, and the volunteers, have had their vaccines and can continue to do the amazing work they're doing. Sorry, I know I started off talking about booster, but it joggled my memory about the care workers, because they have to get their booster, and some of them haven't even had their first and second doses. So,
okay. Thank you. Just to clarify, sorry, I have put the vaccine survey monkey link in the group chat. Ted kindly pointed out that the link on the Champions newsletter takes you to a Twitter poll. It's the same survey, but those of you that haven't got access to Twitter, please use the link, the Survey Monkey link that I've put in the group chat. There's another question in the group chat, not a question, more of a comment from Deborah. Deborah, do you want to voice your comment, please? You know, unmute.
Hiya.
Yeah, go for it.
Yeah, what it is we're feeling it as childminders, there's a bit of double standards going on, in the fact that we're now expected to accept children who could have a parent that's test positive at home And yet we've got these children coming into our own homes, which then puts other children and our families at greater risk. And yet if someone tests positive in our home, we have to close because we're not allowed to work. There's no financial compensation with regards to us having to close for 10 days. And yet, you know, if it was a nursery setting, because it's not a residential home, they would still be allowed to continue. We feel a little bit like we're being thrown to the wolves. That was my statement.
I know, Deborah. But I was just reading your statement, and I remember you brought this up, didn't you, the last time? Well, it might have been the time before then.
Yeah.
And unfortunately, yeah, you're right. We're now there. So 16th of August was this week, and we know now that anybody who is a household contact, who's had their 2 vaccines, or who's under the age of 18, will not need to isolate. I've read the comment. I'm not 100% sure about the closure of business. I'm assuming you mean if you test positive and you're unable to work, isn't it? As the main business owners, childminder in the household. Unfortunately, I think just thinking about what we said before, you're going to have to perhaps have a conversation with whoever in the council works with you around your. I'm just thinking you must be registered, isn't it, with them as a childminder? So the registration, the commissioner of that service, perhaps explore with them what support is available, if any. Because at the point we are at now, as we prepare for the schools to come back, we know already this is going to happen in schools as well, where you have all these children coming to school now who don't have to isolate anymore as contacts. And a lot of people have already started to ask what we'll do about that and how that helps to control spread and what have you. And that's one of the reasons why we're trying to really ensure that as many people who are eligible have had their vaccines, so that even if contacts are coming along to your setting, you're less likely to develop severe illness if you did contract COVID-19. I mean, the other thing to bear in mind is that, I mean, I know of at least 1 or 2 occasions where people were household contacts and didn't necessarily go on to test positive for COVID. Doesn't mean that, you know, contacts are not necessarily at risk of developing COVID and spreading COVID. I'm just trying to reassure you and to explain that, you know, we empathize with this situation. And I think these are some of the examples of the challenges we will face as we try and get back to some kind of normal and come to terms with living with COVID. So it gets to a point where even if people have flu and their household members have flu, even though flu is very contagious, you wouldn't expect everybody in their household to isolate. You know, they would still go about their normal business. And then the guidance says that if they then develop symptoms, you know, they then have to isolate because they have to get tested and ensure that they haven't got COVID-19. So I think it's all about the risk of onward transmission and balancing that with the need to go back to normal and avoid continuous disruption, particularly for young children who have not been able to access education for the last year and a half. And, you know, I think we really have, as you say, a lot to think about. And I would really encourage you to have a chat with the service leads in the council who support your area of work, and do let us know what support they can offer, if any, because we can then share that with other people.
Thank you, Mudipe. And then I think Deborah followed up. I think again, this is a question that was raised previously around ventilation in schools, but now that what she's saying now, well, will there be any consideration for secondary school pupils about vaccination? Now a second manufacturer has approved, I think you're talking about the Moderna vaccine being approved for 12 to 17-year-olds. I think obviously it's the vaccines approved for 12 to 17-year-olds. And again, as Mudipe said earlier, I think, you know, 12 to 17-year-olds will be invited. It'll be invitation only. I don't think it'll be a mass where everybody has to get vaccinated. It'll be a case of those that are probably at risk. There'll be a priority list, and they'll work through that priority list, and they'll be invited. I don't think we can blanketly just get everybody vaccinated. And again, it's going to be personal choice as well. It's not going to be mandatory. That's correct, isn't it, Madupe? Madupe?
I'm reading the chat. Sorry, I was just trying to
Yes,
see because
yes.
yeah, you're right. So I think it's parental consent for those who are
Yeah.
from the age of 12 to 15. For those who are 16 and 17 currently being vaccinated, you don't need parental consent. And the offer of the vaccination, I think, is already there even before this announcement with Moderna. It's good that we've got the Moderna as a backup in case there's any problem with supply, because now we're not just offering to the younger children, but we'll also have the adults receiving their boosters concurrently. So there's a lot of vaccines to provide, in addition to obviously the pressure we're under to be equitable in the way we provide vaccines by helping other countries who may not have as much supply as we do. So the plan is to offer the vaccines to the 12 to 15-year-olds. Please do bear in mind, though, we're still waiting for the logistics on how that's going to happen. We've been told that because of their age group and the fact that you need to do this properly, we might require that there's, no us, so the NHS might need to have pediatric specialists offer them the vaccine. GPs may be given the vaccines, but it's got to be done in a coordinated way, and the consent processes need to be followed. So we're still not sure whether it's going to go through the schools. There's some clarity being sought as well, because as you know, Birmingham is part of two CCGs, now ICSs. So we have to work with some, perhaps half of the borough. Ultimately, whatever happens, I think every child who is eligible, and as Habib said, who is able to be consented to have the vaccine, will be offered the vaccine as quickly as possible. And I think the guidance around schools has just been published today, and we've been reading that and trying to understand what happens anyway if there are outbreaks in schools, how we can support the school head teachers and the children so that they can avoid disruption to learning. So there's quite a lot that we're dealing with, and taking into account that we're now moving, as we get ready for school, we'll be moving into the autumn and the winter, and there's flu as well as COVID and the normal viral infections that they've already predicted might be perhaps a lot more severe this time around. We think it might be because there's less face coverings, and because the rules around face coverings have changed. So one of the things we're trying to ensure we do as we prepare for the children to go back is those simple things about hand washing, that we know already from the first wave, actually more later on in the year last year, made a difference. Hand washing can really help to reduce the spread of COVID-19 amongst the younger children, because as you know, they're very physical and tactile. They'll touch each other, they'll touch their noses, they wipe their hands with their noses with their hands. So simple things like hand washing. You're right about the ventilation when the weather is nice enough to allow it. We will ensure that we're working with the schools to really encourage that. And if the parents can prepare the children as well to come back to school and be ready to carry on washing their hands, and doing as much as they can to protect each other, that would really help a great deal.
Ted, you had your hand up? Can I unmute and ask your question, please?
Yeah. It's just about the survey, which I've just been looking at on SurveyMonkey and stuff like that. And I've noticed that on question 4, it says if you need more information about pregnancy, fertility, side effects, vaccine ingredients, and having existing conditions. Now, my experience with the people who I've talked to who are a bit reluctant or frightened of it, would want to tick more than one box of that, but you can't. You can only tick one of those boxes. And I think there's an assumption that you might put other information in the box underneath, which my experience on SurveyMonkey, people don't tend to type in stuff, and especially people whose typing skills aren't good or English isn't the first language.
Okay.
It may be preferential if number 4 could have multiple answers, because if you click on pregnancy and fertility, you can't then click on side effects, and if you click on side effects, So, you know, so I know somebody who isn't doing it because they're worried about the side effects, but how does it affect their existing condition? And I think
Yeah.
if we're going to gather data as to what people are thinking about it, we need as many answers as possible to look at why they're not doing it. Otherwise, everybody might just click side effects and we think it's all side effects, when actually it's the ingredients and the effect on their existing condition.
Sure. Thank you. Thank you for that point. It's a very valid point. And as I said, this is a snapshot, real short survey that we did just to gather a little bit of intelligence to drive in terms of like how we're going to do the main campaign. So when we do the next one, we won't be using SurveyMonkey. We'll be using a different platform, which will allow us then to kind of like broaden some of the options.
Yeah.
And I think we went with those. That was just like from anecdotal evidence. Those are the most common themes that were coming up in some of the work that we've done and some of the evidence that we've gathered. So yeah, point taken, and we will definitely increase that.
And I think somebody's already suggested that, you know, perhaps not in a newsletter, but if you can send out to the champions the link to the SurveyMonkey as a separate
email,
email and stuff like that, because otherwise, if they click on the one on Twitter and they have to log in, and you know, not everybody wants a Twitter account.
Sure. Definitely.
I've got a Twitter account, but I can't remember how to log into it because on all the devices I've got, I'm already logged in. I'd have to go and look at my password.
No problem. Point taken, Ted, and we will. Thank you for that. And this is the whole purpose of these and point of these conversations. We will tomorrow we will email the link out to all the champions in that format as a backup as well. Thank you.
And I'm assuming we can share that link with some of the organisations or groups or individuals. Fine. Okay, that's grand.
Yeah.
Lovely. Thank you.
Yeah, we did. You can do. Yeah, can do. Okay. There's the next question is, Medipa, is there a breakdown of the local hospital admissions as to numbers of people who've had 0 jabs, 1 jab, or 2 jabs? Have we got that data, or can we share that maybe at the next meeting?
I haven't got yes, I think we can definitely bring it to the next meeting. And I've literally just had a quick look and asked my colleague who leads on that. So she said that data is being analyzed at the moment. So when I say the data, I'm not sure how much of it she has because we don't often get the information fully, but we'll try and do an analysis of the data we've received over a period of time and see whether we can get an average over a period of time. I think that would be a lot easier.
Thank you, Medipa. So for benefit of Jane that asked that question, we'll get the information hopefully at some sort of breakdown at the meeting in fortnight's time. Okay. I'm just looking to see if there's any more questions. Okay, there's no more. Any more questions from anybody else? If we move on to the next agenda item. Okay. Right. So the next agenda item is really ask for yourselves. Now that we're kind of like almost 4 or 5 weeks into step 4 of the government's roadmap, we just want to kind of like hear from yourselves what are some of the themes, recurring issues? Are there any issues for your communities in terms of now we're out of some sort of lockdown, or in terms of some sort of normality? What are the issues? What's pressing? What is it that people are approaching you about? Any themes? Anything kind of like in particular? It's open to anybody. Yeah, go ahead, Ted.
I think the one thing that's coming up most is in some ways it's not confused messages, because I don't even know if there are any messages anymore. But you know, do you wear a mask on a bus? Do you not wear a mask on a bus? Do you wear a mask in the shop? Do you not wear a mask in the shop? I know we keep on saying closed spaces, but if you wander around town, if you go into shops, and if you travel on public transport, then it's about, you know, you're lucky if it's about 50% of the people wearing masks. And if you then look at photographs and film from football matches that took place over the weekend and stuff like that, there was hardly anybody in football stadiums wearing masks and stuff like that. So I think you know, then there needs, I know everybody's really pleased that, you know, we're at this phase now, and we're moving away from the big lockdowns and stuff like that. But I think we need to keep on reiterating in a constant manner, and it's not just the local authority, it is health, but it also needs to be the government, which I know you've got no control over. But the fact that, you know, yes, there is preference and preferential that we carry on wearing masks when we are in, like has already been said, when we're in closed spaces, when we're in, you know, large numbers, not for our own protection, but also for, you know, protection of others and still sharing. So I think that, for me, that's the confusion that's out there, because people are going, oh yeah, we're just getting on with it and stuff like that, and they're looking at the numbers and they're going, yeah, well, it's not the numbers that we thought it was going to be, so we're okay and it's all over and done with now, and it's not.
Yeah, I mean, I'll come to you, Ruth. I'll come to you next. I think one of the things that we can do, Ted, I mean, we are constantly pushing, you know, the hands, face, space kind of message. One of the things that, if it does help, what we can do is kind of like, we'll break down kind of like, you know, the personal risk assessment, and we can put something out around exactly what we assume a tight space is. If you're in a crowded area, we'll encourage people to wear masks. Obviously, it's not mandatory, but what we can say is, if it's a crowded place, whether you're in a shop or, I don't know, there's lots of people around and ventilation is poor, and you know, you find it difficult, then please wear a mask or avoid going to that space. So we can put that message out, but unfortunately, again, it's not mandatory. All we can do is just advise, so people are aware. Ruth, you had your hand up? Yeah, Ruth, go ahead. Yeah, you're not unmute and ask your question, please.
Okay, sorry, yeah. I was reading one of the government reports that came out the other day, which was a big survey of older people who were prepared to talk to them and say what effects that they had had from self-isolation and were still having. And these are mostly people who still aren't going out. And it was quite horrendous, really, the amount of older people who felt that they've lost mobility, that they've lost, it's very high proportion, that they've lost sort of mental health, that they've lost confidence. And picking up on the last person's report, I mean, I do go out and about, and I think the problem with saying to people, oh, if you feel uncertain, you should wear a mask, is that the masks that we wear do not protect us. The masks that we wear may stop us shedding germs more widely if we have the virus. But in terms of, will they stop somebody inhaling the virus, the type that most people are wearing is probably not. And I think that one of the things people would find extremely alarming, given that these are probably older people who normally would use the bus and do go into their local shops, is just that the lack of social distancing now, the lack of thought, the sort of on buses, there's probably a minority of people now on my bus route that wear any kind of mask. As winter comes on, they will start shutting the windows on the bus, even though it says please keep them open. They will also, when schools go back, there will be large numbers of school children standing in the aisles, people talking very loudly on mobile phones. And I don't see that the people who answered that survey, who, unlike me, have not yet gone out, have lost a lot of physical fitness, have lost a lot of confidence, will get any kind of confidence in going out at all once they get out there and see it, what's going on. I'm not so, in some ways, yes, I think masks are a sign that people are thinking about each other, but the social distancing now in shops, people reaching across each other, large groups of people walking around together, standing in groups in shops. I think that there's probably up to 25% of that age group of the population or more who have lost considerably their independence during this, and they're not going to get it back in the way that people are behaving at the moment, while the figures are as high as they are. Thanks.
Thank you for that. Thank you for that, Ruth. There's also a question in the group chat, Medipa, in terms of Dr. G. It's frustrating that Dr. GPs are still closed, where everything else is kind of opening up. Why are Dr. GP surgeries still closed?
I tell you, if I got paid 10p for every time I've been asked that question, I'll be a millionaire. I don't even have to play the lottery for that one. I mean, it's part of why I think with the conversations we've been having about going back to normal, coming to live with COVID, the reality is at some point, we're going to have to go back to normal. We're going to have to accept that COVID is now part of, not just here in the UK, but the world in terms of infections that we're now dealing with, just as we do with HIV and flu and other infectious diseases. Why the GPs are still not open, I think that varies again from place to place. I think that tends to come up in some meetings, and in other places, GPs have opened up. So the advice we would give in that respect is please contact your GP, your CCG. There should be a patient advice liaison service, PALS, or your NHS England service that you can raise this with. I think Habib's kindly put the details for the PCN as well, because the issue with access to primary care remains a big problem. And now that we have an infectious disease around, the last thing we want is people who need care not being able to get care, and then they end up, developing, an illness, and on top of that, getting infected with COVID as well. So please do continue to raise these issues, and we'll make sure as well that we bring this up at any of our partnership meetings that we go to. It would help actually, maybe if you send the detail of whichever GP practices that you're aware of, maybe to us, because we can then pass that on, isn't it, Habib?
Yeah, I was just
But that's
typing
really
that.
helpful.
Yeah, I was just typing that because I can't see the colleague's name on there. Oh, Scott. Okay, yeah. We'll raise it. That comes under Black Country and West Birmingham, and we'll raise that with that CCG. And I can also, if you send me an email, please, if you email me directly, which means I will have your email address, I can send you the details of who to contact and who to raise the issue with. Silver, you got your hand up. You wanna unmute and ask your question, please?
It wasn't so much a question. I was just aware that the previous person, Ruth, spoke extensively about her thoughts and the impact it was having on vulnerable people and the older people. And I just felt it hadn't been responded to as much. And it was quite a loaded statement. And I'm actually interested as to your comments on what has been said, because it's quite a high proportion of people who are perhaps feeling that way. So I'd like to have a response to that, please.
Medipa, do you want to respond first? To Ruth's comments about lots of people that are still struggling or finding lots of people that are still struggling and finding a challenge to come out. It's still a risk for them to come out, and obviously in terms of them staying indoors, there's all sorts of other implications with that.
This is why we continue to work very closely with any voluntary groups or commission providers who support the vulnerable and the elderly. Absolutely agree with you. I mean, there's so much still going on. And although there's a semblance of everything's back to normal and the people are just listening to you all, people have the impression that, you can just go out and everyone is happy, jolly, and taking advantage of the restrictions. The reality is a lot of people are still very fearful for their lives. People are still losing loved ones on a daily basis. We hear the announcements on TV. And so, in our view as public health, we still need to support these people who face isolation, who face the risk of severe illness. And that's why we still work with our commission partners, and we're still working with yourselves as champions to understand what the need is and what support we can offer. And with faith leaders who are being, leads on that. It's very difficult to continue to I think for us to continue to, raise awareness about these issues without touching on the fact that there are many people who are still impacted by COVID and that we are not out of the woods yet. We cannot stress that enough. So I think that's a really valid point, and it makes, I think, a case for the work we continue to do with yourselves, but more importantly, what we can do with that is take that message back. And if there are any vulnerable people that you know of, elderly or otherwise, who are struggling with accessing help or support, again, we can signpost them to the services that we work with, who we've commissioned to work with these groups if they're not known to them, because they're out there and they're still working with groups even as we speak. And they haven't stopped doing the amazing work they're doing. I hope that helps.
Thanks for that. Sylvia, are you okay with that response?
That's fine. I just felt that it was quite a loaded statement from Ruth, and it just felt it needed to be answered in that way. So yeah, I'm happy with it, and it's just a matter of if Ruth's happy with that response as well.
Sure, thank you. Ted, you got your hand up?
Yeah, it's sort of to go back to that, because some of the organisations I work with and some of the communities I'm connected with are connected through the neighbourhood networking scheme, which is part of the city's commissioning programme around working with community groups. And also I work with organisations that deliver on the prevention of communities. And I think there hasn't been this discussion about how do we support these activities. Some of the organisations are still only offering phone support and distance stuff, and some are talking about reopening. But what we're not talking about is the type of stuff that was put into the chat about, I've got it there, which is I think Deborah put in about about her mum and panicking, and I think people's fears of going out. And I don't think, whilst you may be talking at a strategic level, I haven't heard anything, or either at a constituency level or with the community level, that's been raised. That how do we start supporting, not offering services to people, not offering somewhere to go, not restarting the services that we ran in March 2020 before lockdown and stuff like that, but how do we support, how do we hold the hands of people who have lost both confidence and, in some cases, as somebody pointed out, and colleagues of mine have pointed out, people's mobility, people who have been in their houses for the past 15 months are not going to be as mobile walking down the street as they were 16 months ago. And I think I think that's a serious conversation that we have to have at that level, at that community level, and not just, tick a box, and we've discussed that, at the strategic level and with our community, with community groups and stuff like that. And we as champions have to start challenging some of those community groups that we know to look at how do we begin to do that, because there are going to be people there who are quite happy to remain indoors because they're just absolutely terrified in going out.
Sure, I'll comment on that. Let Ruth come in. Ruth, you got your hand up, and then Said, I'll bring you in. Ruth, you got your hand up. Go ahead. Unmute and ask your question, please. You need to unmute, Ruth. Ruth, if you can unmute and ask your question, please.
Okay, sorry, it's because I'm in the car, getting a bit wobbly here. Right, okay. My main point was really that I was shocked that there hadn't been any kind of national discussion actually about that report, because it's a gov.uk report, it's a commissioned report that the government, and I know they've got a lot of other things on their minds at the moment, but that report, actually, I read it before all of the stuff about Afghanistan. And I think it's an incredibly important report, because you know, it's all about Freedom Day and getting back to normal, and you go into Birmingham city centre, and that's pretty much what you'll see. But in fact, there's going to be, and there's a lot of emphasis on, you know, children's results and children, their missed years and so on, and how are we going to get them to catch up. But this is an incredibly important group of people that are the children's grandmothers, grandparents, and sometimes not such old people who just haven't been out. And the figures are there, but nobody's talking about it. And so that's why I brought it up, really. And I think there ought to be more of a both local and a national public response to it. Okay, thanks.
No, I totally agree. I mean, nationally, there isn't any noise being made, and we haven't heard anything. And a lot of it is, you know, those kind of discussions are driven first nationally, and then before it comes down to a local level. Ruth, could you kindly share that the link for that report, please, with us? And then I think obviously there is a need for a more wider discussion with both points, in terms of the points that Ted made around organization and groups that may be commissioned to be doing some of that work, or the lack of work that they're doing, but also just a general conversation. So I think we need to have a wider conversation, something that we will definitely push up the chain, and we'll report this back to Justin so he can push up nationally as well, in terms of, well, you know, what conversations are taking place about that. Is there a conversation being had nationally? If there is, it's not trickling down to a local level for us then to be able to have that discussion with yourselves. But yeah, we'll raise that. Syed, you had your hand up.
Yeah, good evening, everyone. Based on the comment and the question on surgeries being closed, I just sent a message to my GP, and he's replied with his response. And I think this probably applies to all GP surgeries. And his response is, surgeries were never closed, been open throughout. Just everything now is on phone triage to avoid COVID, and also possibly mingling with vulnerable and sick patients. So it's just a slight change in the way they're dealing with public, but their official response is that they've never been closed. So that's straight from a South Birmingham GP practice. I just wanted to share with everyone.
Thank you, Sad. I think what's happening is, well, the message isn't really clear, because there are, I know which GP you're referring to, and what's upsetting, I think, for people, from my experience, is that it is mixed, because there are some surgeries that are actually seeing people face to face without an appointment. You can just walk in, like how people did previously. And if they were thinking of going to phone triages, even prior to COVID, that wasn't communicated, so people weren't aware. So everybody just assumes that surgeries were closed and they're only doing phone appointments because of COVID. The fact that they were thinking of doing that before, not a lot of people were aware of. But again, like I said, we'll raise it with the CCGs, and I'll have a separate conversation with Sunita regards that. Sunita, you got your hand up.
Sorry, yes, I was just going to say, the surgeries have been closed. It is telephone consultation only, and I personally believe, I mean, I've sent you an email about this, but you know, physical diagnosis is different from a photograph. Everybody needs to be physically seen, and I just think you have to get to the root cause of a problem. My colleague has had physiotherapy, remote physiotherapy, and she's actually said it's a complete and utter waste of time. You know, and now we're having to pay for her physio via work, and that's really not acceptable. So I really do think that this needs to be addressed by whoever is responsible, really, the CCGs or whoever.
Yeah, I mean, point taken. I also, during COVID, I also had remote physio as well, and it's, as you say, I mean, there are certain things where you have to actually be seen face to face, and there are some things that you can do virtually. Diagnosis, I personally feel, I totally agree with Sunita, particularly majority of diagnoses are probably made better, and it's a more of an informed diagnosis if the patient is seen face to face rather than virtually. I mean, I have the same dilemma with my own GP practice, Sunita. You know, I have to phone up, book an appointment, and then at some point in the day, my GP will ring me, and it's a phone conversation.
Well, I've had one just yesterday, and I've got to wait for a week to get a physical appointment. So I know I had to ask for it. It wasn't volunteered, which I found amazing. But anyway, I'm not gonna.
No, that's fine. If it does help, what we can do, I mean, it's no promise. What we can do is we can invite somebody from one of the PCNs or even one of the clinicians to come on to maybe the next champion school, which is on the, I think what they did, say whatever date it was, the next one in 2 weeks time.
I think.
Yeah, 1st of September. I'll invite a GP colleague or somebody from within that.
It just has to be consistent across the Birmingham area.
No, definitely. And I think it's important that they hear, obviously, when they hear it from us as professionals and they hear it from yourselves, are two different things. I think if they hear it like excuse the pun from the horse's mouth, it probably has more of an impact, probably will have more of an impact. And they need to know that this is information that we're getting, and it's not something that we're kind of like fabricating or we're exaggerating or whatever. So yeah, what we'll do is, I think good way forward will be to invite a colleague to come on to, I'll ask them to come on to the next call, if not onto one of the calls in the near future. Is that okay? Okay.
Thank you.
You're welcome. Is there any other issues or concerns that people? Yeah, I know. Yeah, remote physio. Yeah, they posted a rubber band. I was posted a rubber band, and she actually she actually showed me what to use my shoulder. So she was showing me the exercise to do from her side, and I was trying to do the exercise on my side. So
sorry, I just fire up. It's like remote massage, really.
Yeah. I mean, and Deborah's point, well painted in terms of the digital exclusion. There's lots of people that can't, that are digitally excluded, that haven't got access to the internet, or even if they've got access to the internet, they can't directly access it. Hence, they can't have Zoom calls or virtual calls or whatever with the GPs. Point taken. And what we'll do, like I said, we'll invite a colleague from that fraternity to come along, and then they can hear directly some of the concerns that you yourselves are experiencing and some of the communities that you're working with are experiencing. Okay, is there any more questions on that? If there isn't, I'll move on to the next. I've seen a message pop up. Okay, liver surgery. Yeah. So I'm just moving up to the next agenda item. Just getting there. Yeah. So the next agenda item is any other business. I've just got a couple under any other business, and then I'll open up to yourselves. There's in terms of the vaccine uptake, one of the NHS are leading on the vaccine uptake, and one of the things that the NHS has asked is support from our champions, from yourselves, particularly in the Birmingham West area. So that's kind of like Handsworth, Lazarus, Aston, Newtown, Birchfield, Handsworth, that side of the city, for those that aren't familiar where Birmingham West is. And what they're looking for is if there are any of our champions that work, live, or got some sort of influence around that area and would like to support with vaccine uptake, or got any ideas of how vaccine uptake could be increased in those areas. It's not a discussion for now. Please do email me directly, and then we'll have a conversation outside of this. And the other thing was in terms of, again, not an answer I expect now. Again, you can email this to me directly. Other than this meeting, what else is there that you feel that we can do to resource you and better equip you, so when you are having conversations with your communities or the areas that you live in or you work in, or if somebody is asking a question that, not an expert, but you've got enough information, or you feel that you're well equipped to be able to maybe answer that question. So if there is anything else that you feel that you need, please do email us. Ted, you're unmuted. Did you want to ask something or make a comment now?
It was just a comment that it's in the newsletter, a direct link through to the platform, because the stuff that you put in the newsletter is interesting, but there is far more data on the platform, and it's not there anymore. It used to be, but it's not there anymore.
Direct link to which platform, Ted?
The Birmingham City Council COVID-19 champion.
Sure.
Yeah.
Okay. Yeah. No.
There used to be a direct link. You clicked on it, and
Yeah.
you went straight to that platform, and it expanded the data that you put in your weekly newsletter.
Yeah, I noticed
And-
that. So
So that's the only thing, because I have to be honest, I have to look for it and I have to type it in, and okay, it's easy enough to do, but if it's a click in there, that then gives us as champions a bit more information about our area, about data, and about other bits and pieces that we can
Sure.
see in there, and we can start making those arguments with our contacts.
Sure. Well, what we'll do is moving forward, Ted, take those points and we'll ensure that the link to .gov.uk website, link to the platform that you just spoke about now, and also the BCC coronavirus page as well. We'll make ensure
Yeah.
all three of those links
Yeah.
are in the newsletter.
Grant, so thank you.
No, you're welcome. Anything? Okay. Is anybody got any other business? No. If there isn't any other business, again, I just want to thank you all again for giving up your evening and your time to join this webinar. Hopefully you find it beneficial. And if there is anything in between now and the next meeting, please do email me. And the two asks that are the three asks was, if you could, we'll email out the survey again on the SurveyMonkey link. If you could complete that survey for us. Anybody who's got any insight into what we could do to improve vaccine uptake in West Birmingham, please email me. And also any ideas and suggestions that you may have in terms of what are the information we can share with yourselves that will better equip you or give you more knowledge and upskill you more around COVID. So when you're having those informed conversations with people that you work with, or you live with, or people within your area, or people that you serve, then you're better equipped to have that conversation. Okay, thank you very much, colleagues. Thank you, everybody. Stay safe. We'll see you soon. And like I said, the date of next meeting is Wednesday, the 1st of September. Thank you all. Bye.